So the stigma of epilepsy from like your employer, so it can be anything, you can go to work and you lose your job because of that. Either from there or from your partner or from yourself, it all needs to be addressed, and it all needs to be addressed in a very aggressive, if you like, manner.
Hi everybody, my name is Torie Robinson and I welcome you back to Epilepsy Sparks Insights. The stigma faced by many people with an epilepsy is still rampant, especially in low to middle income countries and communities. But today we can hear all about it and what is being done to challenge it by one of the most educated people on the subject, all the way from Kenya, Epileptologist Eddie Chengo. Please do know that although this episode does include some positivity and even a giggle at one point, it does also contain subjects that may be triggering for some people, including at one point the ending of one's life. We choose to include this because this is the real world for some people affected by the epilepsies. If you are feeling fragile, or if this could be triggering for you in any way at all, please do stop watching or listening to this episode and check out another one that will be more cheery, such as the one with Mark Cook about the huge advances in EEG monitoring and analysis.
My background is clinical medicine, and then I furthered my studies to become an epileptologist. I have a master's degree in epilepsy practice. I did that in the UK, and I've worked for almost 20 decades in epilepsy care, doing research and clinical work. So at the moment, I work with Foundation for People with Epilepsy. I've been working in this organization for the past 12 years or so. And our major work at the foundation is basically seeing patients. We're doing a lot of awareness and advocacy, and we are also doing research. I also sit at the National Epilepsy Coordinating Committee in Kenya as the vice chair, and we normally do a lot of lobbying, advocacy about epilepsy, and coming up with guidelines for epilepsy care in Kenya. And we disseminate these guidelines to the rest of the counties in Kenya for clinicians to be able to treat epilepsy better. I also do some write-up for booklets and leaflets for epilepsy information for patients and their caregivers. I also do a lot of research work, especially my passion is working with patients with epilepsy, making sure they get the best care, and more importantly, have a better quality of life.
So Eddie, today I believe we're going to talk a bit about stigma and epilepsy and challenging the stigma faced by people affected by epilepsy. Can you tell us a bit about that, please?
Yeah, so epilepsy stigma in Africa in general, and particularly the area where I come from, it is quite rampant. Basically, around 75% of people with epilepsy in this region are stigmatized, and that's a huge percentage. Stigma itself is the central feature in epilepsy, and it's because of what people think what epilepsy is in this region, because what people think what epilepsy is basically dictates them into the care, into what they feel, and how they're going to seek the treatment for epilepsy. And stigma being an attribute that is deeply discrediting, people feel like you're not quite human, and therefore you are a target for discrimination. People can have either felt stigma, they can basically feel like it's shameful, they feel like their self-esteem is low, or people don't understand them, and that kind of thing. And then we have the enacted stigma, whereby the family members or the community discriminate you because of your epilepsy. And that happens quite frequent in the region where we come from, because people don't understand what epilepsy is. They think that epilepsy is as a result of witchcraft. They think epilepsy is as a result of a curse. They think that epilepsy is as a result of you've done something wrong, and therefore this is a punishment from God. And because of that, then you are a target for discrimination. So what we normally do here, at the clinic where I work, we try as much as possible to address epilepsy in a holistic way. So right from the reception, when you come into the clinic, if we see a patient at the care level, the receptionist will just say something about epilepsy. So for example, epilepsy is treatable. So by the time you see the doctor, you already have something, a positive attitude, towards epilepsy. And Torie, this is what is happening. You can imagine somebody who doesn't know, somebody from the rural, and for some reason, they have not interacted with illnesses like whatever, they don't know what is happening in their brain. When you tell them epilepsy is a brain condition, or it's as a result of something in your brain, then they wonder, they're like, okay, so if I have a lesion in my brain, if I have something in my brain, why does it happen once in a month? This doesn't sound like a problem with the brain, because I'm normal most of the time. I don't feel headache, I don't have, this and that. But then this bad thing attacks me and I fall down, I lose, my consciousness, I do all this stuff. How can it be something in the brain? And then after that, I'm okay. So most of the people attribute that to a demon or witchcraft or something like that.
It's amazing, because I'm based here in London, in the UK, as you know, and you down in Kenya, we're about 7 hours flight away, right? It's like we're only like a flight away from each other, but the perceptions of epilepsy are so significant. It's still, even though I've known this for ages, it is pretty shocking, isn't it?
Yes, it is shocking, and that's why stigma is the main issue in Kenya. We just have to address it. We just can't wish it away, because it should be part of treatment. How do you address stigma in people with epilepsy? At the clinical level, when you're doing your advocacy, when you're doing your research work, how do you place it? Because you can't wash it away. It's a big story, that needs to be addressed, and that is what we are trying to do. After our, most of the time when we see our patients, we have this, robust follow-up plan, for the patient. So we try as much as possible to educate the patient by giving them informational leaflets, by following them up, addressing individual, issue into that patient, because every patient has their own issues as well. So we really want to make sure that, we are addressing a specific issue, into that individual. If it's a child, we know, it's issues of the parents telling, poor parenting practices. So we have to involve the caregivers as well. If it's an older person, then we have to engage them and tell them about, bringing up children, work. We're addressing issues about employment and all these things, because the misconceptions right from what epilepsy is the one that causes stigma. So if you think that epilepsy is as a result of a demon possession, then you will be already a target of discrimination and feeling bad about yourself. When we talk about first aid, if everybody thinks that if you have to put something in the mouth, or you have to pour urine, for example, or you have to be, you have to be put in a place where there is a lot of that, so that that demon doesn't attack you even more and more. You wake up in the middle of a lot of that, or you wake up and somebody has poured their urine on you, or you wake up and somebody has stuck a spoon, in your mouth. All this stuff sometimes, also make people with epilepsy feel so bad.
All this contributes to, poor quality of life. And something we spoke about before we started recording, the most obvious to the general public seizures being tonic or tonic-clonic seizures. You also mentioned to me how when people have focal seizures where they don't shake, there's also a stigma against those people. And it reminded me actually of sometimes what even happens over here in the West. Can you tell us a bit about what they might experience, please?
For example, people with tonic-clonic seizure are the ones that experience a lot of stigma, because it's something that happens in a very dramatic way, and therefore people feel like, especially for parents, most of the time they're so terrified. They think that you're just about to die, and that's the expression they give. They will tell you, like, when, for example, if you ask them, like, how is this person having a seizure? Could you kindly describe how the seizure happens? And they just cut it short. They tell you, like, have you ever seen a goat dying, or a chicken? When you slaughter a chicken, do you see what that chicken does or that goat does? That is exactly what my husband does, or that is exactly what my child does, because they are equating it to a person dying. It comes with a lot of emotions. It comes with a lot of questions. And even people with focal seizures, for example, the ones that are non-motor seizures, they are also a target for stigma, because people may laugh at them sometimes for the things that they do, or they may be left, walking around maybe aimlessly, and they can even hurt themselves. And clearly we know that these people need help at that time more, because they are unaware of their surroundings, and therefore they walk aimlessly. They can walk into the road. The solution here is to educate people to understand that, these events are seizures. These events these people can be helped, with proper first aid measures. You can really prevent injuries, and bad emotions to these people. Let me tell you a story, if you allow me. There is this man, he's of age, and he's not married. He stays alone. We once visited him in his village, and he was cooking for himself. So we were just asking him, why are you staying alone? Why don't you get married? And then he asked me a question. He asked me, if you go to the shop and you want to buy a shirt, and you're looking for that shirt, and then you find one shirt that is tattered, are you going to buy that tattered shirt? I told him no. So he asked me, amongst all men in this village, do you think there's any woman who can marry somebody like me who has epilepsy? He expressed stigma, self-stigma. He felt nobody can get married to me because I have epilepsy. So he's like a tattered shirt. So he feels that he's going to be happy alone. Stigma can be very, very bad. There's another very, very sad story that happened in the recent past. There's this young man who, in our region where we come from, sometimes we have the low season and the high season, where we have a lot of people working, and then employment just, because of either they are not tourists or something like that. So this guy had epilepsy. He had a seizure while working, and then they went home. So during when there was work to be done, the employer called all the rest of the people to come and work, but then he was left out. So on inquiring why he was left out, he was told, we have sacked you because you have epilepsy. So this guy felt very bad, and he committed suicide. And he has a family, and he wrote a very, very sad note, like, I don't have any reason to continue living, because how am I going to take care of my family if people are denying me employment? And that is why I am leaving this world. So the stigma of epilepsy from like your employer, so it can be anything. You can go to work and you lose your job because of that. So either from there, or from your partner, or from yourself, it all needs to be addressed, and it all needs to be addressed in a very, aggressive, if you like, manner. Here, if you allow me, drug treatment is equally important. Seizures should be controlled, and make sure that we control seizures at the best of our ability. But if you're not going to address the stigma of epilepsy, if you're not going to address the shame, if you're not going to address the discrimination, if you're not going to address that opportunity that people with epilepsy miss every other day, either schooling, either marriages, either employment, social interaction, then we are not treating epilepsy in Africa.
Thank you. And do you know what? I actually totally relate to what you're saying, because I've thought for a very long time, and I know lots of people, of course people agree with me, no, but I know some people who do agree with me, and that is, what is the point in controlling seizures if your quality of life is still rubbish? Because for whatever reason, whether it be mental health, whether it be, societal influences, and, whether it be your own confidence in yourself. I think, so what you're saying is it's crucial to address these things simultaneously, right?
We try as much as possible as a foundation to address that in a very unique way. For every year, we target, we want to reach more than 5 million people with just two messages, like epilepsy is treatable or epilepsy is not a curse, as simple as that. And we do it in a way that, for example, like now, as we're talking today, one of our member is in Japan, Mount Fuji. He just climbed Mount Fuji. And
sorry, I saw the bloke on. It must be the same. There must be the same bloke. Yeah, I've seen him on Facebook. Yeah.
Yes. So Frederick Belchi is basically, and he's doing that for epilepsy. He's doing, so you can imagine how many people we reach. It will be all over the news. He experienced that stigma. He experienced because he has a sister who has epilepsy, and many people in the villages in his neighborhood had discriminated them because they were saying, you know what, you're the one who is bewitching this girl because you want richness. So he's doing this to prove that, you know what, this is epilepsy. And he goes beyond. He walked 412 kilometers for 12 days. He did the Kilimanjaro expedition.
Okay, I think he is a bit crazy, by the way, for doing that, but not because of the epilepsy. Amazing.
Yeah. Well, when he told me that I'm going to walk for 412 kilometers, I told him, okay, I think you need some assessment. There must be something.
Yeah.
Wrong. Yes. But we reach millions and millions of people, and that advocacy, it works. Every time that is done, people say so epilepsy is treatable. And yes, yeah, it's treatable. So epilepsy is not witchcraft. Yeah, epilepsy is not witchcraft. So we have the epilepsy run every year in November in Nairobi. We have the epilepsy Afro fashion, whereby girls and people with talent come and showcase their talent in fashion and art. We have the Gala Art Expo for children. All these events, we do them every year, and at the end of the year we want to reach as many people as possible with these messages so that we can reduce the stigma associated with epilepsy.
It's amazing. And I think, I have to say, and I have to note, the fact that your organization is called Foundation for People with Epilepsy is just amazing. It's really, really important, because still too many people say, oh, that person is epileptic. And I know some people don't have a problem with that, but I'm not a fan, because people don't want to be defined by their epilepsy, and I think that's especially important where stigma is rife. Would you agree?
Yeah, I totally agree, Torie. I totally agree. So I think the name also speaks for itself. It's for people with epilepsy.
The people, they're not demons. They nothing like that.
No, nothing like that. And there'll be people, even, they are patients today, but there were people before, and they're going to be people tomorrow,
as well as today.
Yes. So it's about that dignity that we want to give to this person, so that he can live, every other day, regardless,
And can you tell us rather, about the research that you've done in, academic research you've done into this? Because that, I think for lots of people, it's crucial to get that sort of empirical evidence and statistics to back up what we've been talking about.
We did research. Basically, I was involved in the initial stages, but my colleagues continued doing the stigma, research. that research basically, number one, was to validate, the tools that were made specifically for this region. So we call them the Epilepsy Stigma scale tools, and it's a 15, question stigma question tool, and it was validated, a very good tool to use for stigma here, and clearly it showed, about the stigma that most of the people in Kilifi, where we come from, have the interpersonal stigma, if you like. It's more of a discriminatory stigma where people feel, apart from what people, the shame, the self-esteem, but also what people think about them, that they are not quite human, that they are not worthy, that they are not, they are demon possessed, and therefore, you're not supposed to be given this job. You're not supposed to sit with us and discuss this kind of work or discuss these important things. So that's very rampant in our region, and I think the whole of Africa. When you read even other research from middle and low income countries, the enacted stigma is more prevalent than the self-stigma, which is, the self-stigma is more common in the West than the enacted stigma. So basically this tool is very, very useful, and at the moment we are doing a project again on stigma. So what we are doing now, we are actually implementing ways to avert stigma, and what we are doing now is we are using what we call the contact-based intervention. We're just using the International Bureau for Epilepsy Stigma Toolkit intervention, which is very, very, there's a lot of evidence that it works, so we are implementing that basically. So we're using the multisectoral, we're using the contact-based intervention, so the stigma bench, and we are also using our social media platform, plus the mainstream media, to reach out, people out there so that they can learn about epilepsy. There was a time we were given almost like 2 hours to talk about epilepsy in the mainstream media.
Ding dong, that's good.
We reached around 8,000 plus people, because it was off hour, but that's a lot of people, when they hear about epilepsy, and either they comment or you see that they have viewed that, or they have, that's quite a number, so we are trying as much as possible. We don't want to leave out the stigma issue in epilepsy in Africa, because that's where the problem is. That's where the burden of epilepsy lies.
I totally get it. And I just want to quickly mention the work that you're doing with the University of Oxford. So it's called Epilepsy Pathway Innovation in Africa.
It was basically done in Kilifi here, and majorly it was just about training, basically advocacy and awareness about epilepsy, but it was more geared towards training of health care workers.
Oh, okay, but that's so important, isn't it?
These are the first responders, so they have to have that knowledge. One problem, Torie, with epilepsy is that, and I really want to say this with strongest, terms possible, epilepsy is not common knowledge as people think. It's not that common knowledge. It's when you look at it from an aspect of that big name epilepsy, everywhere you go and you talk about, do you know epilepsy? Even you go to the most remote part of this world and you ask even the oldest or the youngest, do you know epilepsy? They'll say, yes, that disease which makes you fall, and that contagious disease, that disease that makes you, you'll not be able, that disease that is not treatable. They'll tell you that. So they know epilepsy, but they know it in a different angle. So it's not that common. We know, but we know it. And even clinicians is the same thing. We really need to understand epilepsy in that individual. It's an individual, disease. It's a brain disease, yes, but it's about me. It's about that patient. It's about understanding what really has that patient. And every patient will have their own thing that really hurts them. What hurts me will not hurt you. So when you go there with that common knowledge of epilepsy is to or unprovoked seizures and you have to give this anti-seizure medication, that's the wrong approach. You won't get it right.
Thank you so much to Eddie for being so candid and for sharing with us the cultural and societal challenges when it comes to living with an epilepsy in Kenya. But also thank you to Eddie for telling us about how he and his team are improving things all the way from Kenya to Japan. Check out Eddie's papers and more about his work on the website torierobinson.com, where you can also access the podcast, the video and the transcription of this episode. And if you haven't already, don't forget to like, comment and subscribe to the channel, share this episode with your friends, family, colleagues, and see you next week.